Welcome back to what it will be the last episode of Search Ahead. During the last 9 months, we have talked about global surgery with many professionals from different continents, and we have had the opportunity of sharing with you all a wide range of conversations that I sincerely hope you have enjoyed. We want to end this series of reflections on global surgery with Dr. Jakub Gajewski, Director of the Research Program of the RCSI Institute of Global Surgery. He's a health sociologist with over 15 years of research, teaching, and project management experience. Dr. Gajewski was the lead researcher of clinical officer surgical training in Africa, which was called SURG-Africa, the project that preceded and in a way originated SURG-Africa, for which he is currently the international coordinator and also the lead researcher. Hello, Kuba. It's a pleasure having you here to close this cycle. How are you?
It's a pleasure for me as well to be here on what is apparently the sad, or maybe not so sad, last episode of our Surge Ahead interviews. Thank you.
You have been leading 2 global surgery-related projects during the last years. First, SURG-Africa, and currently SURG-Africa. What are the learnings you have got from working in this field?
Thanks for that question, because I've had a lot of learnings from both projects, which completely changed the way I see things now. Firstly, I learned the power of collaboration. I had been enormously privileged to work with a great group of people from different continents, from different countries, different backgrounds, all aiming for the same goal: to enable access to surgical care for rural dwellers in some of sub-Saharan African countries. And that experience of how to form a consortium, of research consortium, how do you form a group of people who are working towards the same aim while they bring different unique skills, and how does that work in practice? How do you coordinate it? How do you make the best out of your teammates and the best out of your partners? That's been one of the biggest learnings and things that I had observed and then actively took part over the last 7 years. Secondly, one of the most enjoyable and beautiful experiences I've had through the work in global surgery that I've done so far was the experience of visiting hundreds of hospitals across sub-Saharan Africa. And that was a real, I wouldn't want to use a word eye-opener, but kind of, obviously it was a new experience for me at the first time. But secondly, when I started visiting hospitals, I was able to get to experience, to see the bottom of, to get to the bottom of issues that we're trying to address through our implementation science projects. So that's been extremely helpful, and that's been my learning. And the big lesson from that is that, what I've tried to encourage my fellow researchers is that if you're working on an issue, experience it, have some sort of a connection between you and the subject you're researching. Don't be a kind of a dry academic sitting behind your desk researching on something that you have never seen, you have never heard of, you have never experienced. The third thing that I've observed and I've learned is how important it is to have a robust data collection system. Seeing again hundreds of operating theater books, different patient records in district level and across the region, I've observed, how fragile the system is and what is the work that needs to be done to turn it into kind of a self-sustaining research machine, because every information that the hospital produces should be fed upwards up to the level of the Ministry of Health. It obviously needs to be filtered, it needs to be tailored, it needs to be collated in a way that makes sense to policymakers. But if policymakers in a country or any given country, they don't have reliable data to inform their decision, then we are facing a situation where they might be guessing and they might guess in a good way or might guess in a bad way, and that will eventually have an impact on a patient. So these are the 3 main learnings. I would also highlight the fact that participation is crucial. So if you have a project like that, having everyone sitting at around the table, having everyone contributing to the same common goal, which in our case is to access surgical care, but involve everyone who can help, who can help with your work, who can make your work easier, who can make you understand the situation better and trust your partners that, you know, uh, every single detail counts and every single piece of information that they bring will or could work to the advantage of your common goal.
Thank you for the answer. A lot of learnings there. Regarding research on global surgery, what do you reckon is missing in order to improve the field?
From my perspective as a researcher and as someone who's been working professionally in research for a number of years, I think what we're missing is the research itself. There is very few studies. If you compare our discipline to other disciplines, falling into public health or global health, if you compare to, I don't know, HIV or TB, there are thousands of papers or hundreds of thousands of papers in certain cases. So the information about the different aspects of, issues related with a certain condition, a certain disease, is uncomparable. When you take global surgery as an example. So what we need to improve is to just to start doing more research. But what's particularly important is that countries are embarking on a national the ends of surgical anesthesia and obstetric plans, and if these plans are not rooted within research, they will remain at one's shelf or someone's shelf and will start gathering dust without having the potential to be implemented and relevant to the country. Because with research, with information, as you gather as a researcher, you bring the relevance aspect. One thing is to have a stakeholder review meeting and people have brainstorming sessions. This is crucially important and certainly very helpful. On the other hand, if you don't have hard facts, which is data, simple statistics, about mortality, morbidity, the types of patients that hospitals see, geographical profiling, all those different patient seeking behavior, which is something that is being currently overlooked in global surgery, that the way people access care, seek access to care varies from region to region. When you need to put all these different elements together to be able to address any issue in a given context. On the other hand, if you look at what's being published, there's quite a lot. I wouldn't want to say that there isn't anything. There's quite a lot of information. The weakness is that the information is not very coherent. There are only very few papers that kind of summarize or take kind of a multi-level or multi-stakeholder approach to the issues of access to surgical care. But there is a lot of kind of a fragmented information that if you put it together, they start to make sense and start to portray a situation as is. But if you take them as a kind of a just pieces of information on their own, they're not yet as helpful as it can be if, had they been combined into something bigger.
What is the next step? What is going to happen when the SURG-Africa ends?
When SURG-Africa ends, that's what it's as simple as certain life cycles. It started, it was a baby, we needed to develop it, it grew, it achieved its aims and objectives, and right now it's time to fade away. And it was never intended as something long term. SURG-Africa was it's a type of a project that is called an implementation science. So we took something that we knew that could make an impact or could make surgical system in sub-Saharan Africa work better, and we tried to implement it and evaluate it in a limited geographic area to see what are the lessons that we can bring to the local ministers of health, local authorities, for them to realize, that this is a potential area in which they could invest their own funding, scaling it up nationally or internationally. The good thing about SURG-Africa was that it was driven by local needs identified in the preceding project, West Africa. So we knew, that there was a huge demand for supervision and on-the-job training for surgical providers at district level. So there was already a kind of a pre-existing interest at the Ministry of Health level in SURG-Africa, or in an initiative, something that would be similar to what SURG-Africa is today. So we grabbed the opportunity, we got the funding, we rolled out the project, and we are in a good position to say that there is a high likelihood of surgical mentorship and on-the-job training and supervision to be a sustainable part of the delivery of healthcare or the surgical care in the countries where we work. That also comes from the fact that SURG-Africa was very much aligned with national priorities in the health strategic plans and all the documents that applied at the time when we were drafting the proposal. So we took as much as possible from what the ministry wanted to achieve, providing with an example of how this can be done, and lessons learned and mistakes made that they could avoid if once they start scaling the intervention, as we call it, the surgical supervision, mentorship, and on-the-job training across the countries.
Let's imagine, and for a second, that you have all the resources you want and time, money, staff at your disposition. What kind of project would you like to do?
That's a very good question, because I've been thinking about a project, a large-scale project with a potential big impact. I would like to do at a certain point of my career, and the simple issue that I have identified from working across different settings, because global surgery is is the recent field of science that I'm working in, but I've worked in diabetes, epilepsy, different risk management, or different types of, is basically something to do with human behavior. And then what I noticed that in terms of health, plenty can be achieved by just improving people's health literacy. So I would want to have a project that would unify the way people understand their bodies across the world, and come up with an intervention that would train or educate human beings into how to recognize simple symptoms and how to know to cause too much self-harm before you actually go and see a doctor as a response to something that whether you inflicted yourself, or certain things that could have happened that could have been avoided had you had some knowledge about what was actually happening. So that would be my big dream, about a project like that. That applies also to surgical care, certain conditions, if they're treated early, or if the symptoms are recognized before something happens to the body, that can be prevented. So something to do with recognizing symptoms of common diseases, and also on top of that, improving people's understanding of how healthcare system works. So once they step into it as a patient, they have a basic understanding of what are the structures, what are the different elements, what are the different dynamics that they need to follow in order to get the help they need in the easiest way.
Very interesting. Let me know if you do it one day.
Well, for sure.
Well, thank you very much again for your time. I hope you have a very good ending of the project, ending of the year. This 2020, probably not the best. We will remember in a while, but just wishing you the normal things. Happy Christmas and Happy New Year. And again, thanks for your time.
Thank you very much. I would say that 2020 will be the year that all of us will certainly remember. Maybe not the way we would hope to remember it, but it's some unforgettable experience from multiple perspectives about what we've been subject to because of something that we should learn to control as human beings, which is a virus. Thank you. Happy Christmas, and it's been a pleasure.
We started this journey on April, and we thought of calling it Search Ahead as an invitation to look forward during the difficult times of the pandemic. We are now around the corner of a new year, and we want to encourage you all to keep walking, because global health, and specifically global surgery, means nothing without the people who work to make it real. Despite how difficult and how complicated it seems sometimes, it is worth it to search ahead. Thank you very much for everything. Take care and keep yourself safe.